Hi, I'm Baruch Kuppermann. I'm chair of the Department of Ophthalmology and director of the Gavin Herbert Eye Institute at the University of California, Irvine. I'm a retina specialist by trade. Well, it's an interesting question. Anti-VEGF therapy for DMO actually works quite well, but not as well as it does for neovascular age-related macular degeneration and retinal vein occlusion. Those are so ubiquitous because it works 80–90% of the time. Whereas with DMO, it works probably 50 to 75% of the time, maybe 2/3 of the time is a reasonable estimate. So we are looking for other, particularly for the bar has been set very high by anti-VEGF. It really is a dramatically effective therapy. But for DMO, there's a significant subset of the population that has a less adequate response to that therapy. Steroids are the main thing that's been employed to date. The main one of the steroids that's being used is the dexamethasone implant, Ozurdex. But also triamcinolone acetonide off-label has been used for many years. And there's the development of the fluocinolone acetonide implant, the Iluvien implant, that is used as well, much less commonly. It's a 3-year implant, and people tend to use Ozurdex as their steroid of choice, and if it needs repeated injections every 3 or 4 or 5 months, then at a certain point they'll choose to use Iluvien. But beyond that, we're looking for other therapeutic approaches, including Ang-2 therapy and other types of therapies. Roche recently had a bispecific molecule that showed some promising results. They're also looking at kallikrein pathways and other pathways. So anti-VEGF is going to continue to be the mainstay, but we're hopeful that we'll have some other pathway that'll be identified, recognized, and a good therapeutic response. We're getting the first taste of that with this bispecific Ang-2 molecule. It does anti-VEGF and Ang-2, though unfortunately Regeneron, which similarly tested an Ang-2 antibody, 2 separate molecules, did not show a benefit, but the single bispecific molecule to Roche does appear to have some effect. When one looks at the pathway, all the inflammatory cytokines that are seen in eyes with DMO, certainly VEGF is very important. Nobody's ever debating that, and we see high levels of VEGF. But we see high levels of various interleukins and other compounds, monocyte chemoattractant protein, MCP1. So we know there's other compounds, and it's also been shown that VEGF inhibition is actually really very specific. It lowers VEGF levels and not those of the other inflammatory cytokines. So we need something that's broad-based. And so combining, but steroids, conversely, are very effective at all the other inflammatory cytokines and are good but not great VEGF inhibitors. They reduce VEGF levels by 80%, but not the 99% plus that VEGF inhibitors do. So it's rational to combine steroids with anti-VEGF therapy. This really gets to both pathways, or both, even though VEGF is a cytokine, it seems to have almost a separate pathway compared to all the other inflammatory cytokines and chemokines. So combining steroids and anti-VEGF have a very strong scientific basis and actually a very good clinical basis as well. From terms of the OCT response, there's not a lot of studies that have shown that clinical benefit yet. That is being proposed. Well, Genentech is working on one now, and there's a lot of work being done on that. It's a port that's implanted onto the eye, and it's then filled with the drug of choice. It's being designed for specific drugs, but theoretically it's a sort of thing that is a device that's implanted in the eye that can be refilled at will. So that looks like it's winding its way slowly through the process for approval. Other long-term drug delivery devices for anti-VEGF are still far away. There's many that are being proposed, many have not succeeded. There have been hope that the polymers used in the Ozurdex implant, for example, might be suitable for that, but there doesn't seem to be evidence of that currently. So we're still working on that. That's something we want, but yet there's just that port that's being developed now, originally by Jean Dewan, developed with Foresight. It's now been licensed or purchased, I'm not sure which, by Genentech, and is being developed by them.